Next is Asia Focus.
At this time,
Philippine President Rodrigo Duterte has decided to ease the coronavirus lockdown in and around the capital, Manila. While most businesses will be allowed to partially reopen with restrictions, his government also promises a refreshed approach to fighting COVID-19 that includes more testing. The Philippines has the most number of cases in Southeast Asia, with nearly 170,000 infections. And now let's talk more about this, and let me bring in our guest, Dr. Wessam Atif. He joins us to get the latest analysis, and he's an occupational and public health consultant based in Manila. Welcome to our program, sir. Now, the government says the new approach will include expanded testing and more door-to-door checks on patients. Do you think this new approach will work, and why it's taken so long for authorities to roll out this new approach?
Well, I don't think the approach is new. Well, the first thing I want to say that I assume that everyone has good intentions, and the government for sure usually wants what's best for the people. But so far, mass testing per se hasn't very much in the Philippines or in many other countries. I think very few success stories. I'm not sure how much it will help. If you'd ask me for a refreshed approach, maybe better change the paradigm, not only also in the Philippines, but I suggest that everywhere. Stop obsessing about or over the number of COVID-19 cases, and maybe start focusing on minimizing other indicators or focusing on other indicators, maybe minimizing fatalities. If you have scarce resources or limited resources like what we have here in the Philippines, it may be better to invest it in improving and boosting the healthcare system capacity. Maybe that would be a little bit of a different approach, maybe more ICU beds, more hospitals, better working conditions for the workforce that pay for the healthcare workers, maybe more medical supplies and access to healthcare services, etc. This will sure help minimize fatalities, I think, and may be more effective than just doing more and more testing, because we've been doing testing so far.
Well, you mentioned paradigm changes are needed in containing the spread of the COVID-19. Could you elaborate on these indicators that you were talking about, Mr. Atif?
Yeah. Well, first, as I said, we can't stop assessing, not only in the Philippines, but everywhere else, please, about the number of cases. They are the best reliable indicator. I'm speaking as a health professional in the scenario of COVID-19. I'm not saying this is applicable to other diseases. We would focus on the number of fatalities, that's an indicator. The number of cases requiring hospitalization, that's another indicator. And a very good indicator also is the positivity rate of tests, if you'd like to look at cases, rather than just piling up number of cases or trying to count number of cases.
Yeah, and President Duterte also says there is a need to reopen the economy as smaller companies are barely surviving. And I guess this is the question facing governments around the world. How can they balance economic and health needs?
Yeah, I totally agree. I think that this is already a bit too late. When exactly this will end, even with a vaccine, we must now learn how to manage the virus and live with it as an acceptable risk at some point. In the same way, we live many other diseases and risks every day. I'd like to elaborate on that. For example, in the field of safety or health and safety at work, we study something very important called risk acceptability. And what we do in risk acceptability is a common practice of judgment of the balance of risks and societal benefits. This means that in real life, sometimes the management or the government in that case would decide to accept risks, even if they may not be very low. And what we do is that we weigh the benefits, so we check the benefits of the control measures, for example, in this case, the lockdown, against other factors like economic cost or convenience or time, mental well-being, etc. And the management of the government then takes this information and decides the risk. So this is risk acceptability. If we believe that they have minimized the risk to what we call as low as reasonably practicable, then this means as low as reasonable enough for life to continue and work and production will go on. We cannot just stop business over risks. So lockdown has negative impacts, not only on economy, but also on mental and social well-being for sure. And I think it is now time that we open our economy not only in the Philippines, but with all precautions, of course. We talk about masks, about
Thanks so
proper
much for your
ventilation,
analysis.
about hand washing.
Yeah, sorry to interrupt you, but we gotta go. Thank you so much, Dr. Wessam Atif, for your insight.